Ovarian cyst. I see a lot of ladies in my office for ovarian cyst. Usual presentation goes something like this. Oh my gosh, Dr. Angela, I was just in the ER last night. And my usual question is, why were you in the ER? And they're like, oh my gosh, I was in the ER because I had this sudden onset of pain and it doubled me over and it was so painful I could barely move. So I went to the ER and they did a CT scan or an ultrasound and they told me that I had an ovarian cyst and that I should follow up with my OB/GYN. So I gotta tell you, most of the time when I have patients that go to the ER for ovarian cysts, most people go directly to the CT scan. The reason they do that is a lot of times when patients or women present with pain in the lower abdomen or pelvis, they want to rule out an appendicitis. So they usually get a CT scan, which will visualize the appendix, but it's not really the diagnostic imaging of choice to view anything in the pelvis. And so, they'll say, well, on the CT scan, it showed that I had, a 2 centimeter, 3 centimeter, however many centimeter cyst. And again, that I should follow up with you in the office. And so by the time I see the patient, my usual line of questioning is, well, how are you feeling today? And they may still either be in a little bit of discomfort, but most of the time, they're feeling better than they did the day before. So ovarian cysts, what are they? All women get ovarian cysts depending on where you are in your menstrual cycle. How we treat them depends on whether or not they persist or, whether or not they resolve. So ovarian cysts, if they're functional, which means physiologic or normal, those are things like follicular cysts, corpus luteal cysts. Again, these are cysts that come and go depending on where you are in your cycle. Most of the cysts that people go to the ER for are cysts that for some reason didn't resolve. They got to be a certain size and then they ruptured. And it's that rupture that typically causes the pain that incapacitates you, that caused you to double over, that actually caused you to present to the ER. And when cysts rupture, they release whatever fluid they contain. It could be clear fluid, it could be blood. There are things such as hemorrhagic cysts, which contain blood. And whatever the cyst releases serves as an irritant to your abdomen and pelvis. And that's why typically once the cyst ruptures, as each day passes, you'll start to feel better and better as your body reabsorbs that fluid. You won't feel completely better until your body has completely reabsorbed the fluid that was released, because again, this fluid serves as an irritant. So, when you come in with the CT scan that says, oh, I have an ovarian cyst or you had an ovarian cyst, I usually always proceed with an ultrasound. If you ever think that you have an ovarian cyst, please ask them to do an ultrasound, because this is the diagnostic imaging of choice in the realm of obstetrics and gynecology. It gives me a better view of your uterus, your ovaries and tubes, and it allows me better visualization of the cyst, because when I actually see the cyst, there are certain things that I'm looking for. I'm looking for the size, whether or not it has solid components or not, if it has external excrescences, septations. All of those things that I just mentioned are eyebrow raisers for me, or, things that would be more concerning for me. And really, I typically tell patients anything that's under 5 centimeters doesn't raise my eyebrows too much, and it's typically something that we can observe. Things that are less than 5 centimeters are less likely to torse or cause the ovary to twist on itself, and that actually can be a surgical emergency. So most of the time when you present to me in the office and you have an ovarian cyst that's ruptured, they typically will have, visualization of the cyst, or they may also say, we don't see a cyst, but we see free fluid in your pelvis, or cul-de-sac, if you will, and that usually is also a sign that you've had a cyst that has ruptured. There's absolutely nothing to do with that other than just to observe. And again, in cysts that are less than 5 centimeters and don't have any of those characteristics that I previously described, i.e. septations, external excrescences, solid components, papillations, these are things that would raise my eyebrows. But if you have a cyst that's just 5 centimeters and simple, typically just observe them. And anything that's greater than 5 centimeters, and I actually just had a case where I met a young lady just basically fresh off the streets. She came in, she said, Dr. Angela, I, was recently diagnosed with an ovarian cyst. It's 7 centimeters. It's causing me a lot of pain. I looked at the ultrasound. She did happen to have an ultrasound. And based on the amount of discomfort that she was having, this was not something that I deemed we would be able to manage conservatively. And so I did take her to the OR, and we did laparoscopically remove the cyst. Not the ovary, but the cyst. We were able to open up the ovary, dissect the cyst wall off of the ovary, spare the ovary, remove the cyst and its contents in its entirety, and she did really, really well. So ovarian cysts, we all get them. Most of the time they can be managed conservatively. Anything under 5 centimeters typically doesn't raise my eyebrows. So there you have it in a nutshell. Hope this was helpful.